So we discussed earlier some of the CMV prevention strategies, either using prophylaxis or preemptive therapies, and that often includes the use of antiviral therapies which target CMV. When it comes to CMV management, when we have to treat people who have evidence of CMV replication, we're often using the same antiviral therapies at slightly bigger doses, and there's a whole other range of antiviral therapies as well.
What are the side effects of the CMV antiviral therapy?
We have a range of CMV antiviral therapies, but the commonest one that we use as first-line therapy, perhaps its most common side effect, is that it can cause bone marrow suppression. So your bone marrow helps to produce white blood cells that fight infection, red blood cells that raise your blood level, and also platelets that kind of helps keep your blood sticky if you have cuts and bruises. And the irony is that CMV infection itself can also cause bone marrow suppression. So if we do see evidence of bone marrow suppression, sometimes it's a chicken and egg situation where we're trying to work out whether it's the CMV infection itself that's causing it or whether it's the antiviral therapy. That's the common side effect. There are other side effects, gastrointestinal effects, nausea, bloatedness, which are quite common with many medications. But different antivirals will have their own specific ones. Some of the second, third line therapies that we use can sometimes affect the kidneys. Fortunately, they're rarely used because our frontline antiviral therapies are usually very, very effective.
Do the drugs for a kidney transplant change if you do get CMV?
So there's lots of things for us as transplant doctors to think about when it comes to your kidney transplant drugs, so your immune suppression, your anti-rejection tablets. On the one hand, if you do have CMV infection, apart from the antivirals that we want to give you to treat it, another strategy which often goes kind of hand in glove with giving you antiviral tablets is to lower your immune suppression burden a little bit. Because from our perspective, if one of our transplant patients has developed an opportunistic infection such as CMV, then that's a sign that the immune suppression that you've been receiving up until then is perhaps a bit too much, and therefore it's a sign for us to lower your immune suppression a little bit at the same time as we try and treat your CMV. So there may be some changes to your anti-rejection tablets on the basis of that, which is a kind of a management technique. Another reason why your anti-rejection tablets may change is I mentioned the bone marrow suppression that can come either with CMV infection or with the antivirals that we use to manage the CMV. Some of your anti-rejection tablets can also cause bone marrow suppression, so sometimes there may be some changes required with regards to balancing the side effects from the infection or treatment and the potential side effects from your anti-rejection tablets.
Is it still possible to get CMV infection whilst on CMV antiviral therapies? And if so, is it treatable still?
So for patients who need the prophylaxis, so CMV antivirals to prevent them from getting CMV if they've been deemed to be in a high-risk group, it would be very unusual for them to get CMV if they were taking the right dose and they were taking the tablet in the right way. Sometimes there may be problems with patients taking tablets, or they may have forgotten to take some tablets, and therefore there could be a risk of seeing evidence of CMV infection. But the commonest antiviral therapy that we use both for prevention and treatment of CMV infection, the dose needs to be adjusted depending on how well your kidney function works. So again, it's important for us as transplant doctors and nurses looking after patients to be vigilant about the need to adjust the dose of that antiviral therapy. So therefore, if people are being underdosed, there would be a risk of them getting CMV infection despite being in that prophylactic period. Vice versa, if people were on too high a dose because their kidney function is a little bit lower compared to what it was earlier after their transplant, there's a risk of getting side effects and possible complications from the therapy. So it's very important that we keep a very close eye on patients, and that's the reason why you'll find that your level of surveillance after you get diagnosed with CMV infection goes up, because the doctors want to make sure that you are well, that your transplant's working well, and just to keep an eye on not just your kidney function, but looking out for some of the side effects associated with the infection itself, but also the treatment.
Is CMV still treatable even if I have finished a course of medications for CMV?
Absolutely. If people have finished a prophylaxis course of the antiviral therapy in their first 3 months or 6 months, if they were to show signs of CMV after that, and the high risk period probably will be when they stop their prophylaxis, then often that same antiviral therapy will be used at a slightly higher dose because the treatment dose is different from the prophylaxis dose. The other thing that would happen if you had evidence of CMV infection would be a lowering of your immune suppression, and that would go hand in hand with the CMV antiviral therapy.
So why can't my doctor just keep me on CMV antiviral medication for longer, especially if I'm already high risk category?
Yeah, the antiviral therapies that we use do come with their own potential side effects and complications, and I think it's just balancing the risks and benefits with regards to that. The reason why it's only given for the first 3 months or the first 6 months after your transplant, depending on what your risk category is because those early months are when your burden of immune suppression as a transplant patient is at its highest. It's also the period of time when your risk for rejection is usually at its highest. Once you go beyond those first 3 months or 6 months, and your level of immune suppression is a lot lower at 3 months or 6 months if you've not had any rejection compared to what it's like in the first day after your transplant surgery, the balance of risk versus benefit would suggest that stopping your antiviral therapies and reducing the risk of getting side effects and complications from that is the best strategy because the chance of getting CMV are not completely diminished, but they are a lot lower.